Good day, and welcome to our webinar, Getting Aseptic Presentation Right, Avoiding the Pitfalls of Contamination. I'm Anneke Willems, and I'll be your moderator today. We have just a few brief announcements before we begin. First, this webinar is designed to be interactive. In the bottom of the screen, you have the opportunity to click Chat and Q&A. If you are experiencing any technical problems, please use the chat function, so we can do our best to assist you. To ask questions that are related to the content of the presentation, we would like to ask you to use the Q&A function. You can check a box there to make sure that your question is asked anonymously if you like that. And now on to the presentation. Discussing today's topics are Tommy Smith, Technical Leader EMEA at Oliver Healthcare Packaging. He is based in Ireland. And Jeff Pavey, Technical Fellow at Oliver Healthcare Packaging, based in the United States. I will now turn it over to Tommy to begin.
Yeah, thank you, Anneke, for those introductions. So guys, in today's webinar, we're just going to talk briefly through the agenda and what we're going to discuss today. So we're going to look at the definition of aseptic presentation from the ISO 11607 perspective. We'll then move on to the difference between peel strength standards and actual user experience, following on then to the impact of non-sterile packaging, and then on to tearing, particulate and contamination. And then finally, we'll finish up on general guidance around usability factors. So ladies and gentlemen, just before we get started, we just would like to talk briefly about a disclaimer. So the information you're going to see today is based on the understandings and discussions for discussion purposes only. We basically, what we're going to speak about today is from our perspective and our experience. So it's also always recommended, to investigate appropriate sources and resources applicable to your application for further advice. So the first part of today's webinar is going to look at ISO 11607 and the definition of aseptic presentation. Okay, so now if we look at the definition of what aseptic presentation actually is, and this comes obviously from the ISO 11607 standard, it basically says that aseptic presentation is the transfer of sterile contents from its sterile system using conditions and procedures that minimize the risk of microbial contamination.
And Tommy, I wanted to emphasize that aseptic presentation is about microbial contamination and not other types of contamination.
Yeah, for sure, Jeff, that's a good point. So Jeff, if we now look at, the definition of aseptic presentation from the MDR perspective, specifically if we look at section 11, it states that the device and manufacturing processes to be designed to eliminate or reduce as far as possible the risk of infection to users and patients.
You're right, Tommy. And in sections B and D talks about allowing for ease and safe handling of the device and also to prevent microbial contamination of the device. So MDR emphasizes and talks more about devices and not as much about packaging, but this is an opportunity that highlights aseptic presentation and packaging. So it emphasizes the opening feature of the packaging and the aseptic presentation and technique that you have when you're opening the package. So Tommy, when we're talking about aseptic presentation, it often leads into discussions about opening and the presentation, and that's pretty standard. But then those discussions go into what if scenarios. What if the materials are tearing, and what if there's particulate being generated?
Yeah, Jeff, I think the key takeaway really is there's aseptic presentation is it's not that it's simple in that it can be quite complex because there's a lot of parts moving parts that need to be looked at and modified and reviewed when doing your definition and reviews of aseptic presentation, such as tearing of materials and particulate, like you said.
Yeah, that's a good point. And let's start by talking about just the opening and presentation portion of it. Hey, Tommy, in ISO 11607 Part 1 in Section 7, the usability and evaluation for aseptic presentation, it talks about that two things. One is that aseptic presentation shall be evaluated and documented. and they are both shell statements, so we know that any shell statement within ISO 11607 are requirements that you must do. 7.2 goes on to further identify what that assessment needs to be, and that is identifying where materials begin to open. Also, making sure that the technique is without contamination or damaging of the contents. And then in section C, the ability to present the contents aseptically.
Yeah, Jeff, and just following on from what you've just spoke about regarding the usability evaluation for aseptic presentation, whereby the usability evaluation for aseptic presentation shall include assessment of the ability to identify where to begin the opening, and that's a really key thing, because sometimes we all presume we all know how to open up a primary packaging pouch. However, some people don't. So across the industry, I'm sure we're all aware that there are multiple ways to open a pouch, and probably the number one style is by using a chevron style pouch, which you'll see here on the top of the schematic, which is probably fairly show and tell. It's pretty simple to open from the top, and you open in one continuous motion. The other options that you have as well to open is you can use a corner peel application, either via the left or via the right side of the primary package. You also have the option of double corner peel, which makes things probably that bit easier as well for people that are not so trained to the eye. And then finally, for kind of weld pouch applications, so where substrate is well bonded to another, we have a tear notch application whereby you can physically tear open the pouch to remove that product from its primary packaging.
So Tommy, basically what you're saying is the design of the opening features are telling you where to open the pouch, correct?
Yeah, exactly, Jeff. Yeah, because it's just it's not always clear to everybody. Some people take things for granted. So I suppose the key here is to try and to point the end user in the right direction at least.
Okay, so now that we've looked at typical design features, now let's look at some additional identifiers of where you can open a primary package. And we've one illustrated here, which is a double-ended thumb notch, and this is has some real benefits, and really for the end user who is really unsure about opening, so really they can open from either end, even though we do always recommend that when opening a primary package, if there is a chevron on it, you open from the chevron end. But I suppose it's intended basically for ease of opening. That's really the main point of the thumb notch, so either end. And it really is, well, it's a really identifier, so it also identifies the opening spot too. So it really is a really pinpoint place to where to go to. But not only when you talk about additional identifiers on primary packaging, there's other ways we can do that, and they are like by printing symbols on, such as peel here, or just a picture, an illustration that can also be done quite easily. And then finally, really for me, what's very important is that training of the end user is so important, so they're fully up to speed with all these different designs, because as we know, they work through multiple different packages, so they open multiple different products on a daily basis. So to train them so they are fully aware of all the different variables around primary packaging, I think is incredibly important.
And Tommy, I'd like to add a couple things. One is a comment on the thumb notches. The thumb notch at the chevron end is for the end user to open the package, and the thumb notch at the other end is for the person that is a medical device manufacturer who is actually filling and sealing the package to insert the medical device into it. And also that you can see the picture to the right, that thumb notches come in different designs and shapes. For example, rounded thumb notches are very common, the most common in the industry, and also there are additional ones like square thumb notches. Getting back to ISO 11607, in 7.2, the usability evaluation for aseptic presentation shall include the ability to open the sterile barrier system without contaminating the contents, and also present the contents in an aseptic manner. Also in ISO 11607, and then second note, under usability evaluation. It says to avoid the risk of contamination of the sterile contents by the external edge of the seal or closure, which is not sterile. This is something that nurses do on a regular basis because they're taught that the seal is not sterile. Actually, for non-porous packaging materials, it's theoretically filtering from the outside edge inward the microbial ingress or any other contamination coming inward. So theoretically, there is some place within the seal starting from the outside edge that is not sterile. So what nurses do is just kind of draw a line in the sand and say, to be conservative, I'm not going to touch any part of the seal to make sure that I am not contaminating the product.
Yeah, Jeff, it's quite interesting you say that, and I think it goes back a little as well to the couple of slides ago when we were talking about additional features, and we were saying the importance, of just training the end user to, ensure that they're fully aware of all the different opening features and how they open them. Like for instance, 12 to 15 inches away from their chest, and they open in one continuous motion. Those features again, I think they're highlighted throughout the 11607 standard, but it really, the training is so important to the end user.
Agreed. And some of that training entails things like techniques of knuckle peeling and then a continuous peel from there, different ways to present a product. So it is really important that nurses understand what the open features are and intended to do, and they are consistently trained and taught.
Yeah, thanks, Jeff, for that insight. It's quite interesting. Okay, guys, so next we're going to move on now to the next stage of our webinar, which is we're going to talk about the differences between peel strength standards and actual user experience.
When looking at the human factors or the human interface with aseptic presentation, a lot of people start thinking about how peel strength affects the user experience. And that is true because peel strength is a factor, but it's not the most important or influential factor. And one common mistake that people do is they take a common test method like ASTM F88 and then apply the peel strength forces of ASTM F88 to the user experience. And that's not true. And that's partly because of the fact that F88 takes peel strength values perpendicular to the seal versus a user experience is parallel to the seal. And here's a video to demonstrate what we're talking about. You can see in the video that the peel is perpendicular to the seal and that the seal width is typically 15 millimeters or 25 millimeters in width. And that width is important to discuss and its influence on the peel strength as well and the peel strength values. And to continue the discussion, let's talk about why seal strength isn't the most important factor, but I think that design is actually the most influential factor. And that's because that the seal width of the opening features like chevrons, corner peels, or versus flat seals, for example, or the rail seal width, whether it's wide versus narrow, etc. And here's a video that we can start talking about how that happens and demonstrates it. So for example, when you're opening a package, and you can see that in this case we're using a tray where it's opening from the corner, and when this happens, you can see that the shape of or the design of this seal allows it to act like a even though you're peeling from a corner, it acts like a chevron. And you can see that in this video that the widest width of that opening chevron-like opening feature is where you're going to experience the widest amount of force. And you can see because it is more of a chevron type of shape and or open from the corner in this case, that the widest may be maybe 10 millimeters, for example, versus the if it was to be opened flat, meaning from the not from the corner, but from the end of the package, it would be very wide, and that could be 2 or 3 inches wide, or maybe up to 50 millimeters. So we know that in ASTM F88 and just in physics, that the width is proportional to the force required to open a package. So therefore, when you're using a chevron or corner peel versus maybe the flat end opening feature, you can see that there's much more or much narrower width area, and therefore much less force to open the package. And then as you continue on, you can see that, for example, we were talking earlier about ASTM F88, where it is the F88 is perpendicular to the seal and is a wider coupon that is being measured. Now, when you're peeling down the rails of a pouch or a tray, in this fact, that you can see that how the seal width is much narrower than 25 millimeters, 15 millimeters. In this case, it might be 3 or 4 millimeters. And so again, the peel strength is proportional to that. So therefore, the user experience for opening a package with a chevron feature, or for example, with narrower seals, maybe narrower seals than the common 3/8 inch wide or 10 millimeters, you can see that that is much different than ASTM F88. And in ISO 11607, there is a brief mention of seal strength regarding aseptic opening and presentation, and that's in the note in section 5.1.9. And the note basically starts talking about the fact that if seals aren't intended to be open for aseptic presentation, for example, weld bond seals, closure seals that are welded, etc., that a maximum seal strength limit is not usually necessary for those types of applications.
Okay, for the next part of the webinar, we're going to talk about the impact of non-sterile packaging and what impact it can have, and specifically we're going to talk about tiering of materials.
You're right, Tommy. When we're talking about aseptic presentation, first and foremost, we talk about opening and presentation, but secondarily, what happens is when you are opening and presenting material, what happens when materials tear? And that's what we want to talk about in this section.
Yeah, Jeff, this section is, for me, it's an interesting one because, in the past, I've been contacted in the EU with regards, questions around, delamination and tearing of materials, and that it's a big no-go from a customer perspective. Jeff, what's your perspective of it?
Well, in ISO 11607, we like to talk and refer to people to ISO 11607 part 5.1.9, section D. And usually when people are concerned about that, they're thinking about this section. And in section D, or part D, it talks about the peel open characteristics shall be continuous and homogeneous without delamination or tearing of the material. And that's where people stop and don't read the rest of the sentence. And that's where they think that it's absolutely not allowed that any kind of tearing of materials happens. But really, if you read the rest of this section, it really clarifies when it is acceptable and not acceptable. So it says that basically that delamination or tearing of materials that can affect aseptic opening and presentation, which means that it's not that you can have no delamination or tearing, it's only ones that can affect aseptic opening and presentation. Now, the historical interpretation of that meant things like encapsulation. So when you would open a package and it would encapsulate the product, now what happens is that the nurse has to reach in and try and grab it and pull it out, and they may contaminate when it is encapsulated. That also hinders them from dropping it into the sterile field. So when that happens, that really is what this historically meant. now it's being interpreted in different ways. So a couple of key things that this addresses in ISO 11607 is one, it recognizes that that tearing and delamination happens, but it also, in the end, basically says when it affects aseptic opening and presentation, that's when it's not allowed.
So for you, Jeff, it really, what we're talking about, the big no-no is encapsulation. Then, in that, if what you were saying there, the end user physically has to reach in and is struggling to remove the device from the primary packaging, that's really the big no-no. It's and then it reverts back to what your interpretation is around tearing and delamination. They are quite different, I suppose, and from an acceptable perspective, you have to really make a judgment call.
Correct. And that leads us into probably the next part of our discussions here, is that what happens when materials tear and what parts of them are sterile and non-sterile. And that's what we'll touch base here in the next slide.
Yeah, I think, Jeff, if we dig a little deeper into tearing of materials, it's evident enough that there's two different types. Normally, there's partial material tear, and then there's complete material tear. But I think what would be interesting for our listeners today is to get our perspective on our interpretation of these.
Yes, and let's start with partial material tear and comparing fiber tear versus encapsulation. So Tommy, let's talk about partial tearing in more detail, in particular encapsulation and fiber tear. Encapsulation could be just severe delamination of one form or another in different types of materials. And what encapsulation, an example, is down in the lower left-hand corner, where you can see that this is hindering presentation, either dumping in the field, or it may cause contamination during attempts to remove it by the nurse, because the nurse may reach in and try to pull the device out and either take the device and contact it to a non-sterile portion of the material that's torn, or may themselves touch a non-sterile part of the package. So there's opportunities there during that encapsulation to affect aseptic presentation and opening. Secondarily is tearing of the material that is more on interior surfaces. So an example is that tearing down in the lower right-hand corner, where it is a tearing that is confined to the seal area. That is not as much of an issue because confined to the seal area, nurses avoid that and touching that already. But when it extends into the interior of the package, then that's where people start to have more concerns. And by the nature of a sterile barrier system, the interior surface should be sterile. So therefore, it doesn't matter if they extend into the interior, they should still be sterile. And so I'm not sure what the concern is at that point. So let's continue to talk about tearing and complete tearing. And the real question in the tearing is really, is the torn material sterile or not? In a dual barrier, sterile barrier system, where you have double packaging, where the inner and outer configuration, for example, an inner outer tray or inner outer pouching configuration, you have and where both materials are double sterile barrier systems, the interior package is completely sterile on the inside and on the outside. They are designed that way so that they can be put into the sterile field by themselves. So if those materials tear, if the inner package, any of the materials tear on the inner packaging systems, then those are completely sterile. So therefore they don't have any microbial contamination and therefore do not affect aseptic presentation.
So Jeff, just a quick question on that. So I get what you're saying, but earlier we were talking about encapsulation, and that if the fact was that that the end user was struggling to remove the product from the primary packaging because of encapsulation, that's a big no-no. But are you saying that encapsulation of the inner package, what's your thoughts on that?
So encapsulation on the and the original contents that we talked about would be affected by the outside only, not the inside. So when you open the outside package, affecting encapsulation at that point would be an issue, because that would affect the ability to present the materials in an aseptic manner. But if you were to have encapsulation on the inner package, again, there is no microbial contamination of that. So there is no opportunity when you were trying to remove remove the contents or remove the additional packaging that is torn to affect aseptic presentation from the inner package.
And Jeff, would the same be if we were talking about fiber tear? So okay, we've answered the question on encapsulation there. If the inner package had fiber tear, would that be the same?
So that falls into the next category, that interior surfaces, whether it's on the a single barrier system or a double barrier sterile barrier system, that the inner contents, the surface of the inner contents, for example, the lid in the lower left hand corner here, is that is all sterile, and the inside of the package is all sterile. So if you have fiber tear or some kind of surface delamination, that is also sterile, regardless if it's an inner and outer packaging configuration.
Yeah, thanks for that, Jeff. You know, I think we've had some really good in-depth discussions there around opening features and tearing. I think for me, the next section is particulate and contamination. So Jeff, would you take us through the next slide with regards to particulate?
Sure. Every aseptic presentation discussion inevitably, talks about opening and presentation and tearing of materials. But when you talk about tearing materials, then it often transitions into particulate, and it really is the questions of what's happening with particulate? Is it sterile? Is it non-sterile, etc. Referring back to ISO 11607 and Part 7 on the usability evaluation for aseptic presentation, in Note 3 talks about sterile barrier system presentation or aseptic presentation, where the exposure of the contents to potential contamination, such as airborne particles, dust, etc., is minimized. So in our discussions about aseptic presentation and particulate, we have to reflect back on the fact that what the definition of aseptic presentation really means. And that is really about minimizing the risk of microbial contamination, where microorganisms can cause infection in the body. Where you have particulate that could be sterile or non-sterile. In a non-sterile particulate means that it's contaminated with microorganisms. So that is something that does affect aseptic presentation. But when we're talking about sterile particulate, there is no microorganism contamination, so it does not affect this aseptic presentation. I do want to take a moment, though, to recognize the fact that sometimes particulate size makes a difference, even though it may not be sterile. And that could be, for example, when you have something that is a direct fluid path where size makes a difference. If you get large particles that are introduced into the bloodstream, for example, that could cause aneurysms or other problems.
So Jeff, just so I'm clear, when you talk about sterile particulate, it really comes down to the size of the particulate, for instance, that's found, and then would I be right in saying it becomes a type of a judgment call, or is there a limit? Or
there is, but it's really based on the application where it's being introduced into the body.
Okay, it depends. Okay, yeah, I get you.
So again, I want to acknowledge that particulate may make a difference or not, but when we're talking about aseptic presentation, it really is talking about the fact that when you introduce particulate, whether or not that, you need to assess whether or not that particulate is really sterile or non-sterile. So to help people think about particulate in the right way and assess it properly, I think it helps to look at the different types of categories and types of particulate that can occur. And I'm going to talk about parent matter versus foreign matter, and loose versus embedded matter as well. So parent matter is anything that is part of the materials themselves, and foreign matter is anything foreign to the materials or the processing. And then loose particulate is of more concern than embedded, because loose is an opportunity where if it was non-sterile, that it could contaminate a device, a sterile device, versus embedded into the materials, meaning it doesn't it has less of an opportunity to contaminate a sterile device.
You know, Jeff, just a quick question, and probably not the easiest questions this, but if you were to categorize these types of particulates, from one being lesser of a burden as opposed to 4 being very high and basically a non-runner, would it be possible to do that? Or like if you look at embedded particulate, obviously when you talk about embedded, you're looking at carbons and gels, but is that actually particulate? In my opinion, I would say it's not particulate. I would say it's part of the polymer structure. It's happened within the manufacturing of the material, and it is part of that structure. So for me personally, I'd say that's least effective. But I just wanted to get your opinion on it.
Yes, I would agree with you that parent matter, common examples that you mentioned were carbon and gels. Carbon and gels are parts of the materials themselves, and they're often embedded into the materials. For example, they can be trapped embedded in the surface, or they can be trapped between lamination structures of a film or foil lamination, for example. So those are more favorable opportunities or more favorable situations, and therefore less have less risk for those, versus loose foreign matter, for example. And foreign matter could be just about anything. It could be hair, it could be bugs, it could be wide variety of foreign matter. And if that is loose, then that is the worst case scenario.
Okay, thank you. Yeah, there's some very good points there, Jeff, actually, yeah. Okay, guys, we're going to now move on to the final part of the webinar, which looks at the general guidance around usability factors. Okay, if we look at the responsibility for assessment of aseptic presentation, at least in my opinion, it comes down to the medical device manufacturer has the main responsibility, but I think the sterile packaging manufacturer can also assess and can also help out as well when it comes to the responsibility of aseptic presentation. But Jeff, I'd be interested to hear from your experience and your comments on this, and who do you think is responsible?
In the end, I think that truly the MDM is the only one that can really assess it, because if you think about the impact to aseptic presentation, it is influences on, first of all, the MDM creates the complete package with the closure seal, and depending on how that closure seal and the fit of the specific device, that all influences aseptic presentation, or the presentation one way or another. So the orientation of the device that's put in there, etc. And also they have an idea of what the intended use is. But on the other side of the coin, sterile packaging manufacturers, SPMs, also provide preformed sterile barrier systems, for example, 3-side sealed pouches. And the SPM has a limited ability to assess aseptic presentation, because SPMs use preformed sterile barrier systems, or creates preformed sterile barrier systems in pouch family categories, which means that they could be used by MDMs for multiple applications and a wide variety of devices. So we don't know what the intended use is. We don't know how well the device will actually fit in it in the end. So those are things that the SPM can't assess, but only the MDM can. And then, in general, what we can do is when we're creating seal windows, for example, for preformed sterile barrier systems, that we can assess it maybe generally or generically based on tearing of materials.
Yeah, I think that's a very good point, Jeff. You know, it just kind of made me think there, you know, of the importance too of I agree, like the medical device manufacturer is responsible, but it just made me think about, you know, the importance of the medical device manufacturer kind of working with that converter and to, you know, to as much as possible to give as much information as possible so that, you know, converter can basically, you know, assess it, you know, select the right material, select the correct, you know, the correct sizing, help them along that journey, you know, to be able to give, you know, the state-of-the-art primary to packaging. So I suppose my point is just to, you know, always work with the converter and vice versa. I think can make massive differences when you go to DV test and so on and so forth.
Again, coming back to ISO 11607 and the evaluation of aseptic presentation, you see that section 7.3 talks about the evaluations may be done under real or simulated conditions of use. And so that gives you opportunities to, you know, do it at sites if you have people that are trained on site in their facilities. In 7.4, it talks about, you know, product family categories and worst case scenarios. So that allows you to not have to assess every single package configuration, but to lump them together in product families. Also, in 7.5, you can take that feedback and, you know, either redo the sterile barrier system or redesign it based on the feedback that you get, or you can just provide additional information to the user when they are when you're assessing the aseptic presentation and opening. And additionally, in the note, it talks about formative and summative studies. So, keeping ISO 11607 in mind, you can do this in many ways, and it's pretty loose so that you can either do this very simple or you can make it complex. For example, to make it simple, you can just take your packaging during your device design assessment and introduce the packaging to the end users and look at their abilities to aseptically open and, you know, and figure out where the opening features are, etc. And you can do that in that way, but you could also make it a little bit more complex and hire human factors groups or consultants to perform those assessments as well.
Yeah, good points there, Jeff. Also to add, you know, you've also got formative versus summative studies. You know, I'm sure most of us on the webinar today are fully aware of what they are, but just to confirm, you know, so with the formative, it's really just, you know, a watch, you know, so basically you're watching the end user opening, you know, so you're giving absolutely zero guidance towards, you know, how, you know, that package is to be opened or that device is to be used. And then when you look at the opposite to that, the summative is basically you will actually guide that end user on the correct way, you know, to either open or use, and then you will observe to ensure that, you know, what's being guided has actually occurred. Yeah, following on from the ways to assess, and if you're looking for additional guidance, you know, we'd make these recommendations of these two bullet points here. The first one is the ANSI AAMI HE75, which is the Human Factors Engineering Design of Medical Devices. So definitely worth reviewing. And also the ANSI AAMI IEC 62366 is also definitely worth looking at from a usability perspective of the medical devices.
The key takeaways are the difference between peel strength standard testing, ASTM F88 standard testing, and actual user experience. And to remember that it is more design related than it is actual strength related. Then you got to remember also that tearing, particulate, and other contamination can be either sterile or non-sterile. So it's important to do and know that when you're assessing aseptic presentation.
Yeah, and finally, on to the next one there, Jeff. You know, from an aseptic presentation and particulate generation, you know, the requirements can be different. So, you know, a clear understanding of the fundamental difference between aseptic presentation and particulate generation are you know, key to decision making. And then finally on to, you know, the usabilities, you know, factors, you know, they can be simple or they can be very complex. I suppose it's really down, you know, to the end user, you know. So, you know, during the device design validation, you know, that's the time to assess package usability, and that's the time to bring in the human factors, you know, and the consultants, just to, you know, belts and braces to make sure everything, you know, is what you intended to be. And then also to complete, you know, the formative and summative studies, you know, to ensure that what you've selected actually meets form, fit, and function.
Okay, guys, so we've reached the end of the webinar. Hopefully you found it of interest, and we'd love to take some questions now if you have any.
Yes, thank you, Tommy and Jeff, for this very interesting presentation. We will start answering some of your questions that came in. I've seen a few coming in, but as a reminder, you can still leave them in the Q&A session, and we will see to answer as many as we can. Let me see, to start with the first one. How often throughout the design process should we engage the end user?
I can take that one if you want, Jeff. So kind of in the design control, initially, well, this is my opinion, of course, but initially you want to do a formative study, and for me that'll dictate how often you need to engage with the end user. So, you know, once that information gathered from the formative study, and once it's locked in and implemented, then it's time to refer to the summative study. So to ensure that the device meets form, fit, and function, really.
Okay, thank you very much for that. I've seen another one coming in. Are there any reasons or advantages as to why you would choose a corner peel or something else as opposed to a chevron?
Tommy, I can address that. Really, the advantages of a corner peel are really for optimizing the layout or footprint of a pouch. The interior of the pouch can remain the same size, but the exterior can be reduced if you go from a chevron to a corner peel type of application.
Yeah, and just to add to that, you know, Jeff, you know, over the kind of our history, and I suppose what we've learned over the years is that, you know, nurses prefer the chevron style pouch in general, and that's simply because of its ease of opening, so that they can easily control, you know, that opening without touching the seals upon opening. And so from an aseptic presentation, it's a very common design. But as Jeff clearly said as well, and what we've also presented in today's webinar, there's, you know, various other different methods and different design features available. Yeah.
Thank you. The next one, is there a requirement to have an upper limit for seal strength for sterile packaging?
I'll take that, Tommy. Discussions about upper spec limit for seal strength, those are really usually long discussions, and there are several approaches to those. So I'll try to condense it and hit some highlights. For example, I guess first off, we often go through the initial stages and ask the questions, or a couple questions, of why is there a need for high-end peel strength value, and what should that value be? Because generally the responses are related to concerns around potentials for seals becoming too hard to open, or just because I need one. You know, there's various reasons why. So it kind of helps to understand what the goal is when you first start. And then, and additionally, after that, the value that we usually get is some kind of an arbitrarily selected value or number. So that, you know, it makes it, it puts things in perspective when we're trying to go through the process with somebody. But in the spirit of ISO 11607, in talking about pouches, for example, the SPM can, and the MDM need to come together, right? And agree on a value that's meaningful, yet doesn't discard or waste good sterile barrier systems. So that's part of the key as well. And then additional discussions are often about, you know, at a high level, about how materials are typically failing in other ways before reaching a high-end peel strength, before it's difficult to open, for example. And this means that the actual high-end spec limits are really related to other failure modes than before you encounter a package that's too hard to open. And then finally, I guess, or in addition, you continue on discussions about, well, if you still need a value, how do you determine or assess that value? And that's because people typically use ASTM FE88 to assess seal strength when the actual user experience is different. As we kind of mentioned earlier, that design and opening features can influence, that experience. And then additionally, there are discussions regarding materials and process capabilities, etc. And I guess the bottom line is that if you absolutely need to have a high impale strength specification value, regardless of the considerations I just mentioned or other ones, you can really reach out to us and we'll walk you through each step of the process and all the options.
Okay, thank you. There's another question here. If the package has gone through sterilization, why is there even a possibility of a non-sterile particle?
Sorry,
I guess I'll start with that one, Tommy, and then please chime in. If it's gone through sterilization, it doesn't mean, for example, if it's a single barrier system, even though you go through sterilization, that only guarantees that the inside of a sterile barrier, inside contents are sterile or tend to be sterile, versus during other exposures to the environments, etc., the outside becomes then or could become contaminated one way or another.
Yep, agreed.
Okay. The next one here is, do you have any thoughts on how the BSEN 868-5/2018 packaging for terminally sterilized medical devices ties into all this?
What was the section in ISO again?
Yeah, so I'll repeat that. BSEN 868-5/2018. It's called Packaging for Terminally Sterilized Medical Devices.
So that's EN 868 and the sections in EN 868 that talk about aseptic presentation or allude to that, correct?
It's the standard that you mentioned, but I'm not sure about the section.
Okay.
Sorry.
Well, so in EN 868, it's interesting because EN 868 tends to, as a document, tends to give more very specific details that kind of imply that they're applied to all packaging configurations. And that's a value for some people because it gives you an absolute black and white criteria. But we know for packaging, for example, one specific criteria doesn't fit all. So in EN 868, for example, may say that it's not allowed any extending of material, a tear material that extends into the interior of the package. Well, previously it said something that along the lines of that you could extend nothing more than 10 millimeters inside the interior of the package. Well, again, I think those are helpful if you want to put it as a starting point, but it really doesn't, that one black and white criteria to fit all doesn't really make a lot of sense. So you really need to think about your application and think about if you're trying to apply EN 868, how that's practically going to be used or not. And then you also, to put in perspective, EN 868 is really just ways to comply with ISO 11607. So there are alternate ways, not an absolute way to do it.
Okay, thank you. Here's a question on what do you recommend is early enough to get involved to ensure that you get the most accurate user needs in the designing process?
I think I'll give you a breather, Jeff, for a few minutes. So getting involved early enough to ensure. Okay, so I'm going to take that as it's the MDM getting involved with the packaging manufacturer. So if that is the case, at least I'd say that once you have your design locked in and once you have your sterilization method locked in and agreed, it's at that stage you reach out, to the packaging manufacturer, because especially within all of our healthcare packaging, is at that stage, that we can kind of support you from a design perspective. So, utilizing all those design features that we showed earlier on and the additional features if needed. And we can give you our perspective and our knowledge from years gone by. Not only that, though, we can also support you from a material perspective to correct, get the right material, get the right size as well for your application. And also, finally, then when all that is locked in, we could, also support you from your sealing settings, and to help you, get through that kind of whole validation part of your study.
Okay, thank you. That makes sense. I have one here. I work for a small company and my team usually does usability testing for the device, but not the packaging. What is the best way to get my team to include packaging in the usability testing?
Well, it's a big part of it. The way to ensure, sterility of the device is via the primary packaging. So, if you don't ensure the usability of the packaging, you're really going to run the risk of your device not being accepted by the end user. So, really it's critical, and I mean critical, to ensure that your primary packaging usability is included in your study.
Yep. There's a question here on how many users do you have to use for a summative study? Is there a guideline there?
Sorry, can you just say it again, Annika?
Yeah, sure. How many users do you have to use in a summative study?
Well, I think the summative study will be kind of dictated by what the formative study was, because the formative study, is the initial, whereas the summative study is kind of the the guiding and then observation. So it'll really be dictated by how the formative study has went and how the changes that have been applied from the formative kind of study, and how your changes have, the benefits they've made, that'll determine how many in the summative.
And again, additionally, the guidance documents on human factor studies and evaluations, I think there is some level of guidelines that says there's more expectations for users, the number of users. Off the top of my head, I want to say it's like 15 or something like that for summative studies versus formative studies. So we would just encourage you to reach out and look at those documents and look at the number of required according to those people that have more expertise in that.
Okay, thank you. In your opinion, what's the best width for pouches?
Okay.
Seal width, sorry.
Let me start with that one, okay?
Okay.
Just, as a baseline, most common seal widths are like 3/8 inch wide and 10 millimeters, right? And really, although in the end, the best seal width is really the one that works for the application, which means that it depends on the situation. So seal width choices typically, have to or consider seal creep. So if seal creep occurs, how severe is it through sterilization and distribution, stresses, etc. And for example, small lightweight device might only need an 1/8 inch seal or 4 millimeters to maintain integrity, whereas a heavier and bulkier one may require more than a standard seal width. Another example is weld seals, where you can have very narrow seals, for instance, 1 or 2 millimeters wide seals. And that's because if they fail destructively, then they're working as intended. So again, there's some standards, but also in the end, remember that there are many options and one size doesn't always fit all. So you have some choices.
Okay, thanks. And when materials tear during aseptic presentation, should the device then be disposed of?
That's a good question. So I think that really depends on the level of tear and the type of tear that's occurred, And another kind of question I'd have for that is, is it a double sterile barrier system? And if it is, anything, in my opinion, at least, inside that double sterile barrier system is sterile. So it is potentially possible to continue to use the device. And now, on the other side of that coin, then if the product kind of can't be accessed, well, then that's a potential problem. So it really depends on the type of tear. I hate kind of not answering the question, but it does depend on the type of tear. And it also depends on kind of what your risk assessment obviously would have been done, and what's acceptable and what's not acceptable. And like if it's encapsulation, and it's you can't take it out, then that's a serious problem. But then yeah, I would refer back to the type of tear, unfortunately.
Okay, thank you. Here's one for a pouch. In pouch design, is there a requirement to have labeling on both inner and outer pouches? This in terms of usability.
It's kind of, because if you have a double sterile barrier system and you aren't you only validate one sterile barrier of the sterile barrier system, then it's required to label which one is sterile and which one is not, to give the user guidance on what can be placed into the sterile field or not.
Okay, thank you. And here's a question for a device packaging that is not very unique or challenging, and there's already similar packages on the market. For example, a standard chevron pouch, would then end user feedback still be a requirement?
I think no matter what you do, you can't rely on previous. I think you always have to take that, okay, it's the same style pouch, but it's a different device. You might as well take both of them with you and just ensure that the end user is happy with it. It depends on the device as well. Is the device bulky? Is it right sized in the package? There's a lot of different variables, but I would always take it back. Yeah.
Yeah, and I would add to that again, there are a lot of factors for your application, what's important and what's not, as far as aseptic presentation in your specific device, how it fits in the package, how it when you're opening, how it influences the opening features, etc. So you can do product family categories within your within your organization to limit the amount of usability studies that you do based on product family categories. But to extrapolate from another application, that may be a little bit more challenging, especially if you have to defend it.
Yeah, okay, that makes sense. I think we have time for one final one because we're coming up on time here, but the last one then is, how is particulate contamination tested during a summative usability study? If it is at all.
How is it?
Well, I guess we can probably approach that from the fact that we get involved in any type of particulate discussion, one way or another, as an SPM, whether it happens during a summative study or in other daily applications. So I would say that we offer and have a lot of experience with evaluating particulate. So if that occurs, to save it, capture it, and reach out to ourselves, for example, at Oliver, and we can help you start to assess what that particulate is or isn't.
Okay, thank you. And with that, we are running out of time. There are a few questions still coming in. So if we didn't get to that, then we apologize. We will take a look at these questions later and then either answer them to you personally or in a general communication to all people that were here, if the information is interesting for that. If you're looking to reach out to us in the meantime with an urgent question or anything, you can go to our website. You can fill out contact forms there too, and we will get in touch with you, or you can send an email to info@oliverhcp.com. As you can see in the screen, you can also sign up for our Pack Talk blog, where we have more educational content. If you like this webinar, you can sign up for that. And we will send you a recording of the webinar afterwards so that you can review it or share it with others if that's of interest. Thank you very much for your attention, and a really big thank you to Jeff and Tommy for presenting this webinar.